Hello, welcome and kumusta? Thank you for joining me. This is How, your occupational therapist, and you are listening to OT Conversations. In this episode, the topic that I want to talk about is the topic of work ethics. There are not a lot of standards out there with regard to work ethics, but this is the situation. In the NHS, the service is free, and so people needing occupational therapy does not need to pay for the service of occupational therapy. And the ones that are providing the service or sustaining the service is the government, coming from the money of the government, and the trust, the hospital, they are buying the service of occupational therapy so that patient admitted to the hospital get occupational therapy. If you cut it short and if you look at it from a different perspective, the ones that are paying for the service is the public. In which case, therapists working in NHS is accountable to the public. They want to make sure that they're able to provide the service, and the public has the right to demand for time, respect, attention, and get the most out of the service. And this is where work ethics can come in, because I have worked with a lot of occupational therapists over the years, and I have noticed a trend in the hospital where occupational therapists are only doing the bare minimum of the things that they can be doing. Obviously, people are respecting the process and they won't do anything in the hospital unless there is a referral, unless there is a formal referral that's been done. And it limits the productivity. If you look at the service and if you look at the performance of every therapist, you can measure that most of the clinical time is spent on half of the time that they are employed. What does this mean? So for every month, and if the person is working full-time of 37.5 hours a week, over a month, that's 150 hours of working hours clinically, where therapists should be putting their service to the patients, face-to-face interventions, or clinical hours. What's happening? Every time I look at the numbers, it is coming out that therapists are only able to deliver at best 52% of their clinical time. That is very frustrating. Now, it's really up to me to identify these problems and highlight these problems and concerns. This then becomes an issue because it is such an uncomfortable conversation. I could say we don't need to do anything. It's free anyway. But there is an ethical dilemma here where you need to deliver. We need to deliver, and we need to provide the people what they needed. Say there's no referral. I've been in a ward, but when I looked at the patient, I went in and I did some round. Already in one scenario, after talking to the patient, I was able to advise the patient of what the procedure is going to be like. I made it clearer for the patient. The patient was independent, but there's a gap there of him not knowing and me talking to the patient, enabled him to identify and to establish and to understand the procedure that he's going to get. Isn't that a better outcome? Yes, that's a good outcome. Another scenario is I went in to see another young guy who works as a part-time contractor in the building trade. And he also does motorbike. So he's young, he's independent, he's tethered to a monitor. And he's to have an operation in 20 days time. And for that amount of time, what he going to do in the room on his own, tethered to a monitor, 22 days of not doing anything. Now, isn't there a problem of occupational deprivation? There will be. Now I have identified that. Also, after talking to the guy, I realized that he was a smoker, which means there is an element where he could quit smoking. And he could have been referred to smoking cessation service, which he is entitled to. It's a preventative service that is offered by the hospital, and we do not know if he had been referred or not. Because I took the initiative of seeing the patient and talking to the person, even without the referral, I was able to identify things, and I could put that as a measure of service, as a measure of public service. And that is work ethics. You do it not because you are being asked to do it. You do it because it is the right thing to do. You don't need to be asked. There is this personal and individual leadership. And we need to have that. We need to have the motivation. And even if you're not motivated, if it is your job, then you need to do it. Work ethics, doing something because it's your job, doing something, and you don't need to be asked that you need to do it. So how come people needed to be asked? Why is it that people needed to be told? Is this the role of a leader to tell people what they should and shouldn't do? The role of a manager. I guess this one calls for me to be a manager. I guess the situation calls for me to be a manager. So work ethics, guys. Don't lose it. Do you know what this thing is called in another language? In a more posh language? This is called professionalism. The act of being professional. The act of doing what you do as a profession. Professionalism. It's not about wearing the right uniform, although you will have professional representation. You can still be professional despite the uniform. That's just minor. So that is one. And where would this fall under in terms of some of the ethical principles? I guess it would fall on the principle of justice. You do what is just. It is just is. You just need to do it. Now, I've just been put in a very awkward position where a member of staff had to be playing around or taking an apparent abuse of the process and the system. And other staff members are seeing it. So I needed to act on it now. I have to do it because it's only a job. I don't like to do it. It's uncomfortable, but I have to do it. This is called professional. It's the thought and the act of being professional. The implication, what am I really telling you guys? What am I telling the listeners, to all the Band 5s, to all the students, to all occupational therapists working in the field, working in the hospital, working and employed by the government, or employed by the trust, in which case they're employed by the government, in which case they are employed by people. This is what I'm telling you, really. Or this is what I would like to share with you. Please work. Don't wait to be asked. Don't wait for your behavior to be called out. You have a job to do, and your job is occupational therapy. So you need to see as many patients as you can. Do face-to-face intervention. Talk to patient. Nothing is ever wasted with occupational therapy. You talk to the patients one way or another. If the patient is independent, you may and you could be performing supportive intervention. And what are these supportive intervention? What does this address? It addresses the affective and the emotional component of that person, which is also our scope of practice. Don't forget about the scope of your practice. Don't forget about the component, the physical component. Yes, that's what happens in the hospital. There's a lot of physical components. The cognitive component, particularly if somebody has had a stroke or a head injury, but the emotional component. We can justify being there for that purpose. The psychological component. And if you tap on this psychological component, you will be tapping on somebody's volition, their motivation, their values, their interest, their spirituality, and their core self. Isn't this what we wanted in the first place? Or are we just treating it as a pure and plain job? Because if you're treating it as a plain and pure job, then you don't need to be asked and you don't need to be told. You just need to see and do. So all you need to do, see patients, make assessment, do the intervention. If there are no interventions, what are the interventions that you're doing? Remember, are you restoring? If you're not restoring, what else are you doing? Are you supporting? Support intervention. When you educate, you support, you empower. You did not restore, you didn't do any ADL retraining for those people who are standing and walking, but you may well have been discussing and talking about their value. And what you're doing is preventative and supportive. It's a win, isn't it? Okay, I hope you learned a little something. And I hope this changes the way you see things. When you are at work, you should be working. When you are in a place where it's paid for by the government or either privately or publicly, you need to return that service. So in the end, this talk is a rant involving occupational therapy, makes it a riot conversation. I hope you learned a little something today. Just remember, always remember, anything you do matters and has an outcome. Until next time, guys, bye.
If you enjoyed this podcast, talk to your friends and colleagues about it. Like it, subscribe, share, and do what you can to appease whatever algorithm that is at play. Just remember, guys, anything you do matters and has an outcome. Until next time, bye.